We have quite a bit of excitement, to be honest, mainly around Farxiga, that you may have heard of, an SGLT2, Bydureon pen, of course. And then we have the combinations. So we have Farxiga metformin combination, and we recently launched the presentation of Bydureon as the pen, and it's giving us a real opportunity to explore around how these medicines are used in combination. Yesterday, I think it was yesterday, we released news on our triple therapy. So Farxiga, Onglyza and metformin in earlier use in type 2 diabetes. And if I look at all of the big conversations I've had since I've been here, everybody's talking about how to use the mechanisms, how to put them together, what order, how heterogeneous are the patients, and how do we mix the science and art and the patient's individual behavior and situation and lifestyle to get the very best possible outcome. And that's where the dialogue's been going, and I think that's pretty exciting. Well, Farxiga's an SGLT2, and there's a lot of excitement around the role that they play both in HbA1c reduction and indeed in weight loss, associated with type 2 diabetes. I've had a lot of time and opportunity to be out on the road talking to physicians in their offices to meet not just them, but their dietitians and other members of the staff. And what they tell you is really interesting. What they tell you is Farxiga, for example, will provide weight loss depending on the patient. It could be 1, 2, 3, 4, 5 or more kilograms, and consequently the patient for the first time gets into a positive cycle. To lose weight, to lower HbA1c, and to be seen by colleagues, family members, even the physician themselves, say, you look great, things are going well for you, you're feeling better. They're starting to adjust their lifestyle, their own diet, because they want to continue down that path. Again, this positive reinforcement is a big step forward in the life of a type 2 diabetic, and it's something that we love talking about, we love hearing about, and proudly puts Farxiga as a foundation stone in combination, we hope, later this year with the DPP4, Onglyza, and indeed with metformin now as Zigdua. Well, we've yet to publish all of the data, as you can imagine, but I think we shouldn't underestimate the two things, which is the efficacy of a DPP4, the efficacy of the SGLT2. Then what's worthy of further discussion is what they're able to do together. And then beyond that, what that means for adherence and compliance for patients, because quite frankly, anything that helps the patient take the medicines the right way for the right period of time gives them a much better chance of a good outcome. And we're recognizing the trend towards combinations and fixed dose combinations is a demand, almost a pull from the patients as much as from us. And then the final piece is what that means in terms of affordability for patients. We talk a lot around bringing new medicines through, and we're asked a lot about how they're priced and what that looks like. We spend a lot of time as a company working around affordability and making sure that patients can get access to our medicines and that they don't have to make sometimes difficult choices in low-income families between a copay and groceries, quite frankly. And so we are working very hard to make sure that individually and in combination, access and affordability play a very big part. It gets exciting for patients.